Hello, everyone. I'm Dr. Darsh Shah.
And I'm Dr. Altamash Raja.
And welcome to Medicine Redefined,
a podcast where we will explore the often overlooked but necessary components of health, what we consider to be the fundamentals.
We will investigate topics and practices that can give you and your patients the best chance to optimize a healthy lifestyle. It's time to move the needle forward and put the health back in healthcare. Welcome back, everyone. We are going to be touching on the big topic of lifestyle medicine with Dr. Melissa Mondala, who went to medical school at Rosalind Franklin University in Chicago, and she received a Master's of Biomedical Sciences and Health Administration. She even trained at one of the Blue Zones, Loma Linda University, for family medicine residency and lifestyle integrative medicine fellowship. To be more in depth, she is a triple specialist in family medicine, lifestyle medicine, and primary care physiatry. She's a holistic plant-based physician, nutritional and wellness expert, health coach, mental health advocate, and recipe inventor. She has been featured in popular media such as Forbes, local news outlets, and social media. She helps clients improve their lifestyle to optimize their health, to achieve their goals, and develop sustainable habits to live a healthy and balanced lifestyle. She is also the co-founder of the Dr. Lifestyle Clinic. Now, in today's episode, you will learn about Dr. Mondala's journey and how she has even practiced medicine, not only in the States, but also internationally. She talks about how she grew up on quote unquote a carnivore diet where she used to eat a lot of meat, but how she has transitioned from that to eating more plant-based. She'll also talk about her current practice, what direct primary care means, and how she is actually coaching and teaching a lot of her clients to live better lives. Without further ado, let's get to the episode. All right, welcome back, everyone, to Medicine Redefined. We have a special guest with us today, Dr. Melissa Mondala. How are you?
I'm well. Thank you so much. Happy New Year to you, and glad to get connected, and it's an honor to be here.
Absolutely. Thank you. Happy New Year to you as well. And yeah, I mean, I'm so glad this has been some time in the making. So we had your husband on, Micah, for episode 22, and you're probably going to be somewhere around episode 50 or so. So
yay, congrats.
Yeah, thank you. Thank you. So, I love to start with our guests talking about the roots, the beginnings, because I think it sets us up well for a good framework in regards to kind of the perspective we have on medicine and kind of just how you developed your practice and the way that you think. So if you don't mind, take us through how you thought about medicine at an early age. Is that something you always knew you wanted to do? How'd you get into medicine?
Yeah, of course. So, a little bit background about me. I grew up in California, and over here, California, I'm Asian American by my background. And when it comes to health, sometimes we kind of forget as humans that whatever we do, eat, and our daily lifestyles are actually a big part of us. When I actually had my health journey started in my teens, when I noticed that, wow, I have a lot of bloating. I have a lot of, I would say, loose stools after certain foods. I couldn't really pinpoint it. When you're a teenager, you're just out there having fun. I was a cheerleader. I was just very, very active, but I thought that was healthy. If you can move, if you can be in a place where you can perform and enjoy life, that was enough. But really, when you realize that your health is not only things that matter, but things that get worse. So it ended up being to the point where I had lots of bloating, sometimes nausea and loose stools, and getting the diagnosis of irritable bowel syndrome was kind of what I discovered through my not just high school years, college years, but then as I pursued medicine. Not only are you in a stressful environment because of the high demands, lack of sleep, and poor health access. I went to medical school in Chicago where you just eat tons of pizza, hot dogs, and fried foods and fries, and you kind of almost try to self-medicate, and it becomes this cycle where I feel bad, I don't feel good, let me just eat more. And the thing is, for me, I just ate more and more, but it ended up being the wrong foods that made my symptoms worse. And so for me, I felt that I needed to really get a hold of the connection between nutrition and lifestyle and figure out that it's not just a diagnosis and here's a medication. Because, yes, I was offered medications and those helped temporarily,
Hmm.
but it didn't really help the root cause. And that's where I love the lifestyle integrative realm, is
Yeah.
because you're kind of going beyond the diagnosis and the treatments, but you're going to the prevention part so it doesn't happen again.
Hmm.
And that's what I was thankful to know, that there was a direct relationship between not just, with reflux and some of these diets out there. They say get rid of processed food, which is a great first step, and spicy food, but definitely dairy has been a big trigger. So cheese, eggs, cow's
Right.
milk. Um, and then also when it comes to the whole food plant based, I would say committing to that was really when my symptoms were completely relieved, and also exercising routinely and then
Hmm.
meditating. All these things became more and more natural after you get through and push through some of those barriers. So when I saw it for myself, it was just life changing, but also I knew from the ERs and the hospitals and that people just kept getting sicker. It was almost like this revolving door, and you
Hmm.
kind of treat one thing, but something else becomes an issue, and you need another medication for that. And so the
Yeah.
medications just kept adding and adding. And so for me, my goal was to essentially minimize medications through lifestyle and integrative methods.
Absolutely. Taking it back, you said in your teenage years you kind of had these symptoms. Was there a specific point in your life that you remember where, not necessarily a flip of the switch, but where you knew you had to make a change, right? As you said, try to find the root cause. And how did you kind of turn around your health? I know you named some of the pillars of lifestyle medicine.
Yeah, no, when you kind of go in your life, and you're looking around you and you're like, oh, they can eat all this food, and but why am I struggling?
Hmm.
Why am I having this essence where I found myself bloating and missing like social occasions? I couldn't really drink, and that, like most teenage college students, um, everything kind of was just so agitated. Cold water would mess me up
Oh,
too,
wow.
and so I would say just going and knowing, like, there has to be a connection between food and my health conditions. And so I just said, let's just try something different. I went to the American College of Lifestyle
Hmm.
Medicine conferences, plant nutrition conferences. I went to Loma Linda as my training, so I'm a family medicine doctor, and then I did residency at Loma Linda, and to just see how, wow, people can be okay without eating heavy, I would say, processed foods or animal products. How it was just nice to see that they can live longer and be on
Hmm.
less medication. So to me, it was just important to make that change, because I did try the exercise. It helped temporarily. My husband Micah, he was like, "Okay, let's go run," and he loves marathons and 5Ks and
Wow.
10Ks. That definitely helped me felt great, feel good. I mean. And then, of course, practicing breathing, and I love doing vagus nerve
Hmm.
exercises to calm the breath and to calm the nerves, because 90% of our gut is made out of serotonin
Hmm.
neuron transmitters. And so just resetting that really helped me. So eventually I committed, and that's when I saw the I would say the life, you know, long lasting change.
For sure. So I'm always fascinated by how people choose lifestyle medicine and really get into it because now as a PGY2, I'm seeing a lot more lifestyle medicine, right? I tried bringing lifestyle medicine curriculum over to the program so that we can get board certified. But when you were going through it, I feel like, there wasn't as much awareness as there is now. So you're board certified in family medicine. Did you know that this was the route you wanted to take when you were, an M1 or an M2?
Definitely not. I would say even during medical school, I was kind of curious about nutrition because I like, um, well-being, and that whole space of feel good lifestyle. But it was just more and beyond. Like, for example, I think I did take a nutrition class, now that you reminded me, as a M1, and it was just so incomplete, to be
Yeah.
honest. It was just so basic. Here's the protein, here's the carbs.
Right.
Okay, calculate your BMI,
Hmm.
and then what does that translate into? I mean, not much, because that's now, thankfully, yeah, that is becoming more basic knowledge, but that's still not to the point where you're helping put a stop to disease and prevent disease. So I definitely didn't have any idea. I was a psychology major in college, so I love just studying human behavior,
Hmm.
and I love studying how we develop habits, and sometimes even our mind kind of just plays tricks on us. Like, if you think about the food addiction out there,
Yeah.
people self medicate with food, or they realize, oh, it's salty, it's sugary, I want more and more, and it's kind of hard to kind of put that in under a pause, and to the point where, yes, some people can have all the willpower and be as positive as they can, but they still really truly struggle with their weight and disease. And so definitely, it was not something I committed to in the beginning. It was just, thankfully, something I was actually just searching for, because I knew there had to be something different. So I went to conferences, read the studies,
Hmm.
read the documentaries that demonstrated lifestyle, and I was part of the trainee. So I'm so glad that you're incorporating that at your school, or trying to,
Trying
right?
to,
It's
yeah.
just it is. It's all about just literally people knocking on every single door, saying this consistent messaging, showing the evidence.
Mhm.
Because as a trainee, even I was blessed to be at Loma Linda, but still the hospital is not. There has much. We have a lot to improve on still.
Mm.
Um,
I was going to
and
ask about Loma Linda because, like, so
yeah,
if the audience doesn't know, it's a blue zone, correct? So was
yeah,
there was there
exactly.
was there much incorporation of lifestyle intervention then, knowing that Loma Linda was a blue zone, social connection, all these things?
Yeah, I would say, if you go back to the history in the early 2000s, they tried to incorporate what we call like a sanitarium, which basically is a
Hmm.
place that emphasizes lifestyle methods to healing. But then, as traditional medicine came on board, and, like, with the insurances, I would say, with procedures and medications, it kind of just blunted all those efforts. And so, yes, the Adventist community practices more of a lifestyle approach, but then, of course, we to get it into the medical realm, so into the doctors, into the healthcare teams and the systems, and the big tertiary system is, it's like moving the mothership. That's not always easy if the healthcare system is not built to reimburse that way, if it's not built to reward and incentivize that.
Yeah.
And so that came with a struggle. I think finally, after almost 5+ years, we finally have whole food plant-based options in the in the hospitals, which is great. They have, I think, now the clinics for lifestyle medicine is probably on its 3 or 4-year-old birthday. Like, I think they
Okay.
just celebrated that, and they have intensive lifestyle change programs that they're launching too. But imagine, they've been, Loma Linda University Medical Center has been around for a long time, but they just started this.
Wow. Yeah. So Ultimash, who unfortunately cannot be here tonight, he's training at Geisinger. And from what I've heard, Geisinger's like also on the forefront of kind of this lifestyle medicine track. They actually have something called the pharmacy that starts with an F. And so they teach their patients actually how to go grocery shopping, at this location called the pharmacy, to really teach them about, whole food, plant-based, and nutrients. And it's super fascinating. I'm excited to see how ACLM can really, drive more of these projects across the nation. So you're from California. You're back in California now, correct? Okay.
Yes.
But you've practiced in other countries.
Yeah, so it's been a joy to. I love not only just traveling. Yes, my husband and I love
Hmm.
backpacking, and we've almost traveled every continent. I'm really hoping for Africa. I just,
Yeah.
it'd be really nice to go there. But at the same time, we served in. I would say, I served in my home country, and literally it took me 20+ years to go there and see the disparities.
Hmm.
Literally, people there, they're bagging themselves to give themselves oxygen.
Wow.
They don't have enough gurneys, so family members are carrying them from one room to the other. The lack of resources is real, and it's probably even more devastating now because of COVID. And so I would say it was just nice to see, not only to see but to contribute to that effort. In the infectious disease realm, I would say that's where that department I saw a lot of TB and infectious diseases that you probably would not see here at the late end stage in the U.S. Compared to the Philippines. And then I went to Guam, and that's where I was able to practice a lot of lifestyle medicine and do some tobacco cessation group classes, um, and also implement lifestyle medicine into their clinics and urgent care. So that was a lot of fun to kind of see it on another level, where literally most people came with obesity, gout, diabetes, hypertension, and knowing how to kind of deliver lifestyle medicine in a very direct 5-10 minute visit versus like a half an hour.
Yeah.
It takes some practice, right, and some skill.
Absolutely. Yeah. I'm super interested in learning about how you manage the cultural differences, right? I mean, lifestyle medicine, even here in the US, is so hard to get across to patients where, you can speak English, the body language is the same, we understand the cultural norms. What was your approach when, you're talking to patients in Guam about these things?
Yeah, I would say to them, definitely food is cultural, it's social, it is the foundation to a lot of conversations. And, sometimes you just literally have to break the ice and say, well, what triggered your gout or your high blood pressure? Do you know what the cause is? A majority of people will say no at first answer. They're like, no, I really don't think so. It just happened. But if you keep just asking and asking it in different ways, they end up just saying, yeah, I think it's something I ate. They kind of point that to, oh, maybe it's that seafood or that meat, or maybe because I'm not exercising. But I think it takes someone to kind of take that time and ask the right questions, and then also showing them that exercise is something that helps heart health and brain health.
Mm-hmm.
And also we need to protect your sleep, because then we will be less stressed, and also our mood and energy will be stable. And then the food is always, like I said, a hot topic. So just demonstrating, literally we would have, I think it was so fun. It was like Chamorro a month. It was like their national month, where they would have their festivities. So the whole hospital actually was plant-based. So they were able to cook meals and show the history of their country, and have the festivities. And of course there was other types of festivities, but they had the option, right? Just to demonstrate and model that for them, that there are people who can thrive off this way of, off this type of lifestyle.
Mm-hmm. Now, to transition back to Cali, you've practiced with heavy Spanish-speaking population. Is that correct? Now,
Yeah,
are you fluent in
definitely.
Spanish?
I would say majority, like 70% enough to get like a whole medical visit and do that. Okay.
Gotcha. So even then, right? I mean, if you're going to be practicing lifestyle medicine, are you seeing that these patients have to come in kind of dedicated with some willpower and initiation to want to change? Or is it more so of you trying to force it upon them a little bit more because of maybe that communication barrier or language barrier, whatever it might be?
It's a whole range. I think the practicality of demonstrating what the power of lifestyle medicine is yes, to show them that there's direct link to their lifestyle to their disease, and also saying, yeah, I've seen this get better. You have diabetes, but if you minimize the processed foods and you start to exercise, have a smoothie every day, increase your salads. I've seen this happen where patients would have their A1C go from 9 to 7 to normal. So giving them just like these patient testimonies help. Sometimes, like if you come with a research book, an article, start reading that to them,
Yeah.
it'll just go over their head.
Hmm.
If you tell them to maybe watch a documentary or read a book, maybe that will inspire them. But the most important thing is just looking them in the eye and saying, there's another way, and this can be free of side effects. This can help you. it's something that you can just give it a try, because your body will thank you, and not only that one organ will thank you, but everything else will benefit. And with the language barrier, I know you mentioned that yes, there's culture and language barrier,
Hmm.
but even just speaking like 50% or even 10-15% of the language just helps so much. Showing a lot of
Wow.
pictures, saying things slowly and repetitively can help. um, and I think there's a lot of, I would say, educational handouts that have
Mm.
translations now, and books that you can look at. And just Plantrition Project, I was just doing a podcast with Chef AJ and Dr. Scott Stoll. They're actually having a new initiative to use all their recordings for their conferences, and make that available worldwide,
Wow.
and that at no cost for medical students. So I think that is where the power comes from. We're truly trying to change our world where it's accessible, where people can know that this is a way of healing, um, and it is a method, and it is evidence based, and it is
Hmm.
scientifically proven. And so I think that's the beauty. ACLM 2 is definitely global as well. But when you just have more and more organizations supporting each other, I think that's the hope that we have.
Absolutely. I find your experiences fascinating. I mean, the only time I've gone abroad was my second year of medical school, where we did a underserved trip to El Salvador. And man, I fell in love. I mean, that's definitely something that I want to continue, whether it's Doctors Without Borders or just even going back to my school at VCOM and being like an alumni doctor who can go with the students and teach. I just think it's fascinating. Looking back, though, at all your experiences kind of abroad and early training days, what are some of the lessons that you've learned from those experiences?
Yeah, I think the real deal is, don't give up on whatever it is. If it's your vision, your passion, if it's that one test, that one concept, you just stick to it, and you try it over and over again, and it will come through. There's a reason why you're in the place you are. There's a reason why something is calling you, and there's a magnet towards what you do. If it's PM&R, if it's cardiology, GI, there's a reason for that. And I would say just continue the path, take a lot of good care of yourself, and take time to relax, take time to rest, and of course celebrate. And when there's something rough and hard, and when you're grieving because there's hardship in our world, there's devastating news left and right, or maybe a loved one that you picked, I would say, be present there too, and get help when you need to cope with those hard times, because a lot of doctors, unfortunately, are poor patients, meaning they if you do there's surveys that they only practice. I would say 2.7% of physicians practice healthy lifestyle.
Oh,
So that's nutrition, exercise, sleep, emotional well-being, stress management. We're just as bad as
oh
patients, and
yeah.
sometimes maybe worse, depending on our training period.
Very true.
um, and so yes, residents are on call 24 plus hours, sometimes breaking duty hours because of the call of the pandemic and
Hmm.
the shortage of healthcare workers. And so my thing is, just always, find time to do what you love, value yourself, and then you'll just be brighter for your patients. Meaning, you'll just be more present, and you'll think clearer. You'll be able to strategize for them. And then eventually, that dream it
Hmm.
is the reality. And I don't think people have to limit themselves, and just keep remembering you are living the dream.
So true. So true. We have a lot of pre-meds, medical students, residents who listen to this. So I'm just going to tell all you guys, go back and listen to that answer again. I think we tend to make healthcare as an excuse, right? Our long hours and the studying. We tend to use those as excuses, but I always say there's no excuse, right? Like, if you can start as a pre-med or medical student to live the way that you're going to tell your patients, like you said, it becomes a reality, and you don't have to figure it out in the midst of, later down the road in residency, or as an attending, and just gets harder to do. So if you can instill those habits now, as an early trainee, you're gonna love it. You're gonna go down and see the evidence base as well, and it'll just make you a better practitioner in the end. So you used to eat a lot of meat, I heard on podcasts, right? When you were younger, you're, so quote unquote a carnivore. and you've now
Mhm.
transitioned to a plant-based diet. How long have you been plant-based for?
Yeah, I would say a total of going on 5 years, so 4 to 5 years. And, I would say it was literally that immersion experience that I had at these conferences and where I saw people eating like that. And I just tried it for myself. And, first thing you notice is, yeah, you don't get the meat sweats and you don't get the bloating and you don't get even those headaches after, like, a lot of processed food just has tons of artificial flavoring, MSG. It's
Mhm.
hyper stimulated, just like media. They throw everything in
Right.
there so that you are engaged and you just want more and more. And so that's why I do primary care psychiatry. I love serving those with depression, anxiety,
Hmm.
addiction, OCD, PTSD, because that's just definitely, they say about 74% of people have mental health conditions once they're in the primary care office. So that means, that's important. But literally, we kind of are under treating them and underdiagnosing them. So they say up to even 50% to 60% is undiagnosed and not treated. And then most of those people who are treated, if you look at those statistics, they say they may not even qualify for treatment. They may not even need it. And that's because they are probably jumping to the medication rather than addressing the lifestyle conditions and their habits as well.
And to go back to what you said, right? 90% of the serotonin is in the gut. We know there's a gut brain connection. We know that by eating plants, you're getting more fiber, right? So you got the prebiotics, the probiotics. If you guys want the in depth analysis on the gut, you guys can go to episode 16 and 17 with Dr. B, Will Bulsiewicz. We go into depth on being like fiber fueled. But this is exactly what you're talking about, right? I mean, mental illness in some way, if you want to get down to the root cause for a lot of these things, can also be the gut. Um, so just eating that, becoming plant forward. Now, are you vegan or vegetarian?
Yeah, I like to say I'm whole food plant based,
Okay.
and just because I even I incorporate vegetarian and vegan meals and all of that. And I would say I love my vegan friends, my allies. They're awesome, but I'm not someone who I don't have. I'm not leather proof,
Sure.
and
Yeah.
sometimes there's also things we don't realize that's inner food. That's kind of hard to like.
Yeah.
I would say pinpoint. But at the same time, I think when it comes to just being healthy, there's a lot of, I would encourage people, there's a lot of fads, there's a lot of diets out there. There's even some times where some people do extreme diet and extreme
Oh yeah.
restriction where it does lead to eating disorders or what we call
Mhm.
orthorexia, which is basically people's obsession over health, that they are doing it to the point, not just because they're losing weight, but they just have the wrong idea about health. And so we definitely are, those are the things I scream to as well. And so when we think about the gut brain connection and immune
Mhm.
connection. So a lot of people after COVID, are having I would say mental health conditions, anxiety, depression, ADHD has been seen. A lot of, I would say, gastritis, worsening of their Crohn's. So that's kind of happening left and right. But I would say at the end, we need to support all systems because that's why I'm a primary care doc. It's all connected to me.
Absolutely. I love that. And I love the fact that, it's not about the labels, right? It's about incorporating more plants, which me and Altamont try to talk and try to preach on here as much as possible. Whether you eat meat or you don't, I don't think anyone, I mean, I know there are people out there who can argue that plants aren't good for you, quote unquote, but I think majority of the data everywhere says get more plants in. It's probably going to help you. So now when it comes to your practice, I mean, you're obviously treating typical chronic illnesses. What are some of the atypical diseases that people may not think about that you're still advising a plant-based diet for?
Yeah, so in my practice, I would say either in the acute setting because someone thought they had appendicitis, or they even thought they had. I just had a patient who had an umbilical hernia, and I think his mesh is probably not as stable as we want it to be. And so those things initially, what does everyone say? Eat, drink lots of water, liquid diet, and literally avoid these high fatty foods. Like if you think about the most acute scenarios, even gallbladder disease, like the recommendations are to avoid fatty foods. And usually these fatty foods, where does it come from? It comes from animal products.
Hmm.
And so high cholesterol is in, that's where I would say cholesterol is made is in animal. And that's why humans have cholesterol too, is because we have that naturally within us, but also we are over consuming it too. So in the acute setting, those are like where I've seen some of those crazy relief that, we may not see everywhere, or in, there's not a lot of, I would say these are anecdotal, but at the same time, the robust studies happen, in the hypertension, high cholesterol, the diabetes, the overweight. Those are the typical, but then it's so nice to see it in relief when it comes to fatty liver, to
Hmm.
anxiety, depression, allergies, asthma. I just so Dr. Scott
Yeah.
Spool, this is like a big announcement. We just went live with him, and so he has this book on disease reversal, and it's real people, real stories on hope, and from A to Z, literally, you can see how these people had many conditions, anywhere from ear infections, from pancreatitis, from panic attacks, PTSD. A lot of
Oh,
our rheumatoid arthritis, scleroderma, kidney disease, stage 4, stage 3, nephritis, all these things, gout, gingivitis. And in one person, Esther was her name, she had 18 diseases.
wow.
And all of that went away. So it's just the possibility, right? It's definitely hard work. It's commitment. And I don't like to oversell and give like for example, that everything will go away, but I'd say the majority of chronic disease can be improved, and hopefully even reversed. And then at the same time, in the acute setting, things can at least be better mediated. Just like
Hmm.
when people have COVID, I'm not telling people to go eat tons of steak and burgers and hot dogs, because
Yeah.
it definitely are, they have pro-inflammatory components that really aggravate the immune system. So I would say we just have to be mindful and recognize that there is a deep connection.
Absolutely. And the body's connected, right? Like I think we're learning that more and more is you got to treat holistically more often than not. When you treat one symptom or root cause, or let me put it this way, you treat a root cause, you see more than one symptom go away, right? And I think what the US healthcare system does in the training is we tend to compartmentalize different symptoms and different ailments for a specific specialty in a way, right? So if it's the heart, oh, it's got to be cardiology and they'll take care of that. And let's not get it mixed with GI or dermatology and et cetera. And, I think what makes a great practitioner is someone who can step back and say, hey, like, how are all these things maybe connected looking at the patient's lifestyle, right? How did they get here in the first place? So I think that's just, yeah, super important connection. And we'll definitely link that book in the show notes. I wanted to ask you because I'm a vegetarian myself, or let me say plant based. So I've never eaten meat because of religious reasons growing up. But I'm pretty secular now, but still continue to eat that way. And one of the most common questions I get is, how do you get your protein? Now, I lift weights, I'm pretty fit. I'm pretty good at strength. So it's a really funny debate at times, when people have to ask me. But I can only imagine that some patients might be asking you that question as well when it comes to eating plant based. What do you tell them?
Yeah, no, great question. So people think that protein is their number one, I would say, macronutrient that they have to have on a day to day, and the largest amount that they need. And I would say, actually, our body only needs, it's really calculated by weight. So 0.4
Hmm.
kgs per meg, and you have to, or mgs per kg, and you have to calculate that. And about 97% of our population is over consuming protein, and only 3% gets their fiber. And so where you get your protein is definitely tons of, I would say, vegetables. Like kale has a great amount of protein, and not just kale, but edamame, and also tofu and lentils, legumes, nuts and seeds. Literally all plant-based items have protein, and it's just a matter of maybe people don't realize that they're missing that, and it's usually because they're missing the sugar satisfaction, the simple complex, or the simple, I would say, carbs that they were meant to be getting on a day to day, because that's what they were telling themselves. So I would say simple carbs through chips and crackers. Those are the things that satisfy the brain. Also, when it comes to what the simple carbs are found in, they're actually the sauces covering the protein as well. When I say protein, that's like chicken and like
Mhm.
and beef and everything else. So that covers it. So when you cover that component with that animal product, the brain is missing all of that. But when you have the plant-based component, it's not just like you're getting less satisfaction. You're actually getting more nutrients, and you're getting away from those addictions that you were kind of dependent on. So well, I always just like to encourage people to, yeah, if you get, two servings, I say 1 to 2 servings of beans or lentils a day would be great. If you get three, I would like to say 5 servings, 5 to even 8 servings of vegetables, that would be great. 3 to 5 servings of vegetables, that's another layer. So just think about what you want to do when you build your plate, but you definitely need a balance. Sometimes people say if you're vegetarian, all you eat is one item, which is like they just say like veggies and that's it, but they forget their nuts and their seeds, um, or they think, oh yeah, you eat just completely raw and that's their imagination. But no, you can have some really amazing cooked dishes that is flavorful with turmeric and herbs and spices.
Oh
And
yeah.
I'm a big fan of veganizing my meals, or even Asianizing
Mm.
um, my meals with a way where I'm satisfied as well.
Absolutely. And speaking about the protein and overconsumption, Walter Longo, right, who's doing a lot of research on longevity, his book, The Longevity Diet, talks about, as he's studying blue zones, that most of these blue zones, they're actually only taking in like zero point 0.3 to zero point 0.4 mgs per kg, as he said, and then they maybe ramp it up to the 0.5, zero point 0.6 once they reach like 60 to 65 in order to keep kind of the muscle mass. And then interestingly, David Sinclair, who a lot of people might know, one of the leading researchers on anti-aging and longevity up at Harvard, he actually switched to a completely vegetarian vegan diet, and is doing like a low protein diet almost too, because he's saying that the body, in order for longevity, has to be stressed, and it has to understand that when it's in a low protein environment, it's going to upregulate like the mitochondria and things that will promote anti-aging. So super fascinating stuff. I'm really excited to see kind of what the data shows moving forward. So you mentioned cooking, you mentioned recipes. I know on your website there are, do you hold courses for cooking? Or I know you have a bunch of recipes on there for sure.
Yeah, yeah, so I collect all of my recipes and I have like e-cookbooks, and I have a YouTube that I'm restarting again to show my cooking. And then I had some courses within my clinic that I was providing
Okay.
for, and I think that's, I love group classes. It's just amazing because you can give each other feedback. You can, one, try something that works for the other. And then I'll be hosting another series so stay tuned. I'll be having more online classes that I'll share with the public. That's not just internal to my clinic. And then eventually I'll be having cooking classes 101, but one step at a time. That's next year's project.
Okay. Yeah, absolutely. I can't, I'm going to have to take a look at those recipes. Some of them just look amazing. So, and we'll definitely link those again to the show notes for everyone to check out. I wanted to transition to your half, Dr. Micah Yu, because I know he's had an incredible journey as well with ankylosing spondylitis, shares similar values to you. And, when your patients come in, obviously your family medicine, right? You take care of generations, you take care of families as well, partners. How important do you find it that families or spouses or, whoever need to share same lifestyle values in order to find success?
Yeah, no, great question. I think, usually it's one that starts and one finds the alternative way of eating and then does the cooking and the heavy lifting. And that's, I did that. And then my husband was able to just observe because, like, is this real? Is this worth it? Is this going to be something that we can commit to? And then essentially he was able to kind of appreciate some of the I would say, changes in him and the science. And yeah, I think it's it's really nice to do it together as a couple. I think it's nice to do it with a friend if you have like someone you can convince or someone who already been on that path, and then you can just learn from them. And I think it's just some people go through ups and downs,
Mhm.
laughters about themselves, and just new self discoveries. Like, oh wow, it's kind of like I've done intermittent fasting before too. You were like, wow, I just have these cravings. It's like unconscious habits you
Mhm.
don't realize that you have. So to have someone there by your side to also go to certain restaurants because they're more plant-based friendly, it's nice that you can do that in a group
Yeah.
setting. It's not absolutely critical. I know people they were alone in this and they done well.
So you said a word there, journey. I love that, right? Because we're so data driven in this world, and I think we're always trying to chase a certain, fat percentage, a certain BMI, a certain weight, a certain biomarker, or whatever it might be. But it's important to realize that we should just not be chasing, but living, right? In the present moment when it comes to our health and enjoying that journey and enjoying the ups and downs. I mean, it's not easy, every day trying to be on point, trying to get the best sleep and the best diet and best exercise. It's not going to happen. It's not possible. But to understand not to get down on ourselves, right? And to really just enjoy that journey and that slow roller coaster ride that takes you up and up and up. So definitely love that word. So a lot of our guests that come on here that are lifestyle medicine based practice, either in a concierge way or a direct primary care way, but a lot of them don't take insurance. And I believe that's the way you're practicing. What advantages have you seen with that model, compared to the traditional healthcare model of taking insurance, 15 to 30-minute visits?
Yeah, no, great question. So I train in an academic center, and in these centers, there are times where you have 15 minutes, sometimes 5, 10 minutes, because you're just constantly running behind because of the the complexity of the health condition that the patient has. You have to literally send someone to the ER, or you have like 10 orders to get, or it's just a fast-paced environment. And so when not only one, you're running either you're running behind because of something in the system, so that just shrinks your time, and then you only are able to address the patient's, I would say, important need of the day. And usually it's just one or two things, but literally sometimes you need to address 5 or 10 things because you won't see them technically maybe in 6 months or a year later or years later. And I think that's where unfortunately we don't have enough I would say points of contact
Mm,
with our patients to see the sustainable change. So even if they were trying to take their medications, surveys show that like up to 60% can be uncompliant,
yeah.
and so meaning that they're not taking their medications, either completely not taking or inappropriately, or not understanding the right technique to take it. So I would say when it comes to the healthcare system, there's just so many layers, right? And of course, it's great to have a multidisciplinary team with a social worker, with a behavioral therapist, with now they're incorporating health coaches. That's all great, but I think as physicians, we are the driver of the system, and we need more and more time with them. And so I love the fact that so I worked in FQHC in an academic center. I worked in urgent cares, as I mentioned, and I just really enjoy spending a whole hour with patients, being able to hear, like I said, their journey, their story, their whys, their hows, getting to know their personality, because not every
Mhm.
personality wants to know the the labs right away. Literally, some people are hiding from their numbers. Other people want their numbers 10 times a day, and maybe that's not healthy for them. Maybe they don't need to look at the scale all the time because they feel defeated.
Mhm.
So I just think that having that freedom to practice 1 hour through a direct primary care model, incorporating lifestyle and all that we do, not only gives us more time, but then also we're not keeping up with all the billing that's happening. There's lack of reimbursement. There's codings, like you literally for vitamin D, you have to put bone loss for them to like cover that lab.
Yeah.
And vitamin D is an essential vitamin, not just for bones, but for gut health, mental health, immune health. And
Right.
so it's just a lot of battling. If you can, there are healthcare systems and like lifestyle practices that know how to beat the system and have strategy, but it takes a lot of not only time to learn it, but it takes a lot of staff. It takes a lot of I would say patience too, and in everything, right? Not just patience, but it takes some tact. I always think there's a system for everyone, and you just have to find the path that you, I would say, can see yourself actually living according to your own lifestyle. But also it's not forever. You can always change your mind.
Absolutely, yeah. We just recently brought on Dr. Peter Valenzuela, and he just wrote a book called Doc Related, and just talks about the broken medical system, and how he got an MBA, and now that he's in this position to make change, he just sees how many layers deep, how broken our healthcare system is, and it really is a shame. And for me, the reason I chose PM&R was kind of exactly what you're talking about in terms of building that rapport with patients, right? I mean, in the rehab hospital, patients can be there up to a month. And, I loved kind of just being that life coach and mentor to these patients, and really, talk about these things after a couple of days in terms of lifestyle intervention and how do we prevent a stroke, right? Now that you have a spinal cord injury, what can we do to reduce the anxiety and depression that may come along with it? So totally agree with that. Now, I know that you like to be a mentor, you like to teach as well. There are a lot of pre-med and medical students right now who have this thought that going into medicine means healing, right? And lifestyle intervention, like we're talking about. But I feel like sometimes there's this rude awakening when you get into medical school and you realize there's only 23 hours of nutrition teaching, right? There's no real stress relief teaching. No one's really teaching you these things. You kind of have to go outside of the curriculum to get either hands-on training or just a better understanding of true healing in the sense of lifestyle intervention. What advice would you give pre-medical students right now going, that want to become doctors and want to practice this type of medicine?
Yeah, I know that you're just trying to see in terms of how do we, make time for this, and how do we not only make time, but how do we stay on track and how it becomes practical. My one of my favorite times are at the rehab, actually, where I was spending time not only getting to know patients, because they were there, like you said, for weeks and sometimes sounds feels like months because they keep
Yeah.
coming back, and they just have complications with their TBI or
Mhm.
their traumatic brain injury or their stroke that just progressed. So I would say those are the times where I say, you know what, this is something that the disease keeps happening, and we just need to keep going. No matter if it's like people in their older or late stage, there's still a place and a time for it, and that can be literally now. And that's what we do. Is lifestyle medicine is now, and to teach and give back and mentor. There's definitely phases, right? I always think we learn and people think you have to learn everything in order to share. And yes, you can develop a certain competence by getting the certificates, by be board certified, to going to conference. But I think you don't have to wait to share the possible therapeutic interventions. Meaning you can share. Yeah, let's talk about nutrition. Let's talk about maybe some healthier options when you go eat out. Here are some things I would recommend on the menu. Here are some things that you can cook at home, or here's this quick, I would say, exercise that you can do in your chair, because if literally sometimes it takes people so long just to get to their physical therapy appointment, right?
Mhm.
Because of access, and they sometimes forget to. So repetition is so important to just say the same message and do it early.
Love that. Have a theme. That's kind of what I did during my residency interviews. I had a theme, and that was creating value and being a mentor and life coach, and stuck with that during, all the questions that they asked. So I like that. What is next for you? I know the inception of Dr. Lifestyle was not too long ago, so congratulations. And what's the upcoming goals?
Yeah, thank you. So basically, Dr. You and I, we have our in-person clinic, and that's also telemedicine. I serve California and Florida, seeing patients in different countries. He definitely has a breadth of state licenses and other. It's like almost every continent for him as well, in terms of people who he served. Planted Forward is another big, I would say, announcement. We developed that, and that's a telemedicine multi disciplinary specialty platform. And so we have GI Dr. Vanessa Mendez, we have Dr. Nicole Hart, who's a lipidologist, preventive cardiologist, and then we have 2 registered dietitians, Amanda Sevilla, and she's great on intuitive eating and mental health, and the other one is Natalie Castro, and she does a lot of the autoimmune and GI disorders. And then we have a health coach on board, that's Jackie, and we're also recruiting too, so we're on our second phase of recruitment, so we're just excited about that. Dr. Yu is he launches YouTube already. We have we're I would say we just like to be in the pulse and in everything that lives and breathes lifestyle and plant-based and prevention, because the wavelengths that are really, it just keeps extending. It's like when you have a wave, you can literally go from a tsunami, right? A tsunami effect, and it goes to the other things that surround it. So we just want to be part of those initiatives, and we're just great to have you also elevating the message. So thank you.
Sure thing. Yeah, we actually just recently had Dr. Nicole Harkin on here, so we're actually waiting to do a 2-parter with her, and we'll be releasing that in the near future about lipidology and plant-based for being heart healthy. Where can our listeners find you?
Awesome. Yeah. So basically, I'm on Instagram, pretty active on there. I'm melissamondala.md. And then also on Facebook, you can find our clinic Facebook there. You can definitely email me if you need to, melissamondala.md.com. I'm sorry, melissamondala.md@gmail.com. Where I'm pretty accessible. I've been helping a lot of, I would say, students, residents, and people who are just pre-health wanting to, have some mentorship. So thank you.
Absolutely. We'll link all of that. And I just really want to thank you for coming on here tonight. This has been amazing. You're probably one of the first few lifestyle medicine doctors that I started following on Instagram. So I can definitely attest to what you're sharing on there, right? It's not only just the knowledge behind and the research, but also just everything that encompasses being a doctor in lifestyle medicine. So thank you so much for doing what you do.
Thank you, Josh. It's always a pleasure, and you always inform me what's new with you, so I can support you. And hopefully, we need more PMR lifestyle oriented docs.
Absolutely, and I think there's more of us coming out there now. There's a big coalition. At least Dr. Beth Frades is a rehab doctor, and now she's trying to make a bigger push for rehab or for lifestyle medicine within rehab. So excited to see where that goes. I do have one last question for you that we ask all our guests, and that is, how do we put the health back in healthcare?
That's great. I love that question, because obviously I think this is the theme of today's talk, is it starts with us. Mm-hmm. It starts with you and me. It starts on a day-to-day. That habit that we need to break, or the new habit we need to develop, is something that is very real, because our patients look to us, and we can only relate to them truly if we practice it ourselves. And then I would say with, we mentioned PM&R, that are some of our applicants for Loma Linda. I was part of the Lifestyle Medicine Fellowship. Some of them were getting a breadth of different specialties. So that's family, PM&R, peds, ER, surgery. We've had just a whole host. And I think literally you don't have to limit yourself when it comes to wanting to imagine what lifestyle medicine looks like. And really, that's where it is. You be you and you stay healthy by incorporating these lifestyle changes each and every day.
You be you. Love it. Thank you so much, Dr. Mondala.
Yeah, my pleasure.
All right. Well, if you're a patient, or you're even a healthcare provider or soon to be one, and you want to learn more about lifestyle medicine, maybe how to incorporate it more into your life or even into your practice, highly recommend checking more of the episodes out on this podcast. Almost all of our guests touch on the topic of lifestyle medicine, but we do have a few individuals who are lifestyle boarded. Also, another big resource that Altamash and I recommend is the American College of Lifestyle Medicine, or ACLM for short, where you can find handouts, PowerPoint slides, and just different resources to understand how you can incorporate this into your life. Now, as always, if you loved this episode and you think others would benefit from it, please share it. We know that 86% to about 95% of issues in terms of healthcare are due to chronic conditions, and we can mediate these issues if we just go back to the fundamentals, which is what lifestyle medicine is all about. Please like and also review this episode if you enjoyed. And as always, the disclaimer, everything in this podcast is for educational purposes only. It does not constitute the practice of medicine, and we are not providing medical advice. No physician-patient relationship is formed, and anything discussed in this podcast does not represent the views of our employers. We recommend that you seek the guidance of your personal physician regarding any specific health-related issues. I hope you guys have an awesome week.